Hello again to the Emerge community. It's Dr. Brian Hartman here for another video on how to improve your health. And today's topic is going to be alcohol use. Just something that's came to mind here lately. And I wanted to make this video to show you where I'm at in life. So I'm in a very busy season right now, so there's not going to be a lot of pop-ups, cool effects in this video. It's just going to be straight talk from my heart to yours. So I'm going to talk about alcohol use in general, and then we'll focus on some obesity medicine-related aspects of it. So part of my time crunch right now has to do with release of my 9th book, Seeds of Change. There's 8 of them up there, but it's the 2nd book in my new Eco-Terror thriller series, with Murder Burger being the first one. The release date's May 1st, and it's currently March 5th, and guess what? I'm not done with it. So I gotta be pretty productive in my non-working hours. Now guess what destroys my productivity? Alcohol. Once the evening rolls around, I have a glass of wine or bourbon, that's it, game over. Nothing else is gonna get accomplished that day, and I don't have time for that kind of lack of productivity. Now, chances are, if you drink alcohol, you've had occasions where you drank too much, right? And chances are, if you've done that, you've regretted it a time or two because you didn't feel well the next day, or maybe you did something while drinking and you wish you hadn't. Maybe you said something that caused a problem, or you got in an argument. Maybe you broke something, or, as I see in the ER, maybe you got a DUI. Or many of my patients, they end up in the ER. I see that all the time too. Now, admittedly, some drunk patients can be pretty entertaining, but ultimately it's usually pretty sad. A lot of times there's a group of people that show up to support the drunken person who's either there for laceration, ankle injury, or head injury, or something worse. But usually they're all having a great time. But almost every one of them wouldn't be there had they not been drinking. So is this evidence of an alcohol problem, or is it a problem related to alcohol? Is there a difference? Let's do a little test. If you drink alcohol, I'd like you to make a list of all the positive things it brings to your life. It's easy enough to say relaxation, right? To de-stress after a hard day at work. But what else would you put on it? Feel free to pause the video, consider it for a while. Now, please don't take this the wrong way. I'm not saying it's wrong to have a glass of wine in the evening or sip a nice glass of bourbon. The problem comes when you refill that glass, or you pour the glass 3 times as large as it needs to be, and then you refill that one too. Or maybe you're hoping the spouse doesn't finish it so you can have theirs. So if you're at risk of doing those behaviors, don't have the first glass. Now look, our kids are watching. It's well known alcoholism is a generational curse. I'm not sure if that's entirely learned behavior or genetic, and honestly, it's probably a combination of both. But addiction-based personality traits extend beyond drinking and often commingle. If this runs in your family, you need to be vigilant and protect yourself and your family from it. And here's a shocking stat. Did you know 15% of people aged 12 to 20 had a drink in the last month? Maybe the 20-year-olds, but the 12-year-olds? Now, I found out recently that one of my junior high school teachers was an alcoholic back at the time, and he told me that he could tell back as a teacher who the drunk kids were in junior high. Take a look at social media trends. It's cool to be a mom who drinks wine, right? It's almost a meme now. And this exploded when COVID hit. And now I'm seeing them show up in the ER. They're 35, have several kids, got a job, and now they have an alcohol use disorder. They didn't see it coming. It wasn't who they were at all, but now it is. It went from fun and games to a problem that they need help with. Now again, don't get me wrong, I love alcohol. I love drinking. I love hanging out with friends and drinking at the beach, the pool, at someone's house, at a game, in Jamaica, whatever. But I also see the negatives and realize it's not without risk. Now recently our pastor challenged us to a 21-day fast starting in January. It wasn't specifically alcohol, it was just anything we wanted to fast on. So my wife and I did choose alcohol. We made it 18 days until an illness ran through the house. Everyone felt awful, and you know what, a glass of wine sounded really good. And after that one glass of wine, then it's like, okay, well, the streak is gone, right? No more power in the streak. So we kind of lightly drank for 10 days before a friend's trip to Jamaica. And like most all-inclusive tropical resorts, we drank a lot, had a lot of fun. But was our fun really enhanced by alcohol? I don't know. I've had a lot of fun while not drinking also. But alcohol does lead to behaviors we might not do had we not been drinking. It's quite disinhibiting, right? And I think that's why many of us drink. We want to do those things, but we know we're too reserved to do them without a little liquid courage, right? There's even a euphemism for it. So it's in effect a gateway drug. It's what enables us to do those things that our normal inhibitions hold us back from. If you drink alcohol, I challenge you to guess your blood alcohol. People claim that 80 or 0.08 is too low of a DUI cutoff, but frankly, I think it's too high if you don't drink very often. Tolerance is real. If you drink 5 drinks a day, you're going to perform better at 0.08% than if you drink once a week and get to 0.08%. I've seen people with levels of 300, I couldn't tell they've been drinking, and I wouldn't classify them as drunk based on my interaction with them. But I've also seen people at levels of 80 that were clearly drunk. So to do the proper breath test, you need to have not drank alcohol for about 15 minutes to kind of clear it out of your mouth, right? because that can alter the result. And you also cannot have vomited or belched recently. Isn't that pleasant? So find someone with a digital breathalyzer and check where you're at. I think you'll be surprised how you feel even well below the legal limit. And you kind of realize where I'm at coming from this. So I'm recording this on March 5th. It's been 23 days since I've had any alcohol, and I do not miss it. I'm sleeping better. I rarely wake up at night to go to the bathroom, and I'm not doing late night binge eating. And I think my gut health is improving, and I'm much more productive in the evenings. Again, back to the books. I gotta be. So if you drink a glass of red wine a day, that's over 800 calories per week. Not to mention the snacking that probably comes with it, and the increased sedentary time after consumption, and then Netflix and chill, right? So try eliminating it and observe what happens in your life. Now, from an obesity standpoint, from an exciting update on that, Eli Lilly is going to start trials investigating tirzepatide, which again is Mounjaro, Zepbound, for use in alcohol use disorder, tobacco dependence, and even some drug abuse. Now, anecdotally, it's been very effective for some people to reduce their desire for vices. They've already shown it's phenomenal for treating obesity, sleep apnea, metabolic-associated fatty liver disease, and diabetes. What else is the magic of GLP-1 medications going to reveal as more people take them over a longer period of time? Now, again, I'm not here to say there aren't potential downsides to them, but from where I sit, the benefits massively outweigh the risks from a population standpoint. Now, obviously, our individual situations are going to vary, but from an overall population standpoint, the benefits from where I stand are clearly outweighing the risks. So I challenge you to consider abstaining from alcohol for a while. I think you'll notice positive improvements in your life and in your relationships. And if you don't like how you feel without alcohol, guess what? You can always start drinking again. But seriously, if you are concerned you might have a problem with alcohol, seek help. There's a federal program that can direct you to resources. It's the Substance Abuse and Mental Health Services Administration. I'll put the number up here, but call them at 800-662-4357. So thanks for watching the video. I hope the new backdrop is acceptable. It's about the only place in our new home that works for this, so you kind of better get used to it. Check out my 5 video series on GLP medications, and let's get healthy together.